So you know that I've been developing this microcrystal surgery now because, it wasn't enough just to have one strange thing called crystal surgery. We have to now go to microcrystal surgery. And of course it all came about because of the remote sessions with the pandemic. But then the problem was I didn't know how to do that microcrystal surgery in person. So I'm going to show you first how I do the microcrystal surgery. And then I'm going to show you the adaptation that showed up for me 2 weeks ago. And how to do it in an in-person session as well. So we'll start with the micro, and then we'll move to micro in an in-person session.
So you're going to work on me.
I'm not going to work on you.
You're going to do microsurgery on me.
When I do the in-person demo.
Okay.
And like this, I'm just explaining the setup to begin with. Okay, so what we're going to do is a brain detox. And I start with my skull. And then I put my botryoidal seraphinite. Remember I was saying seraphinite's so green. That's the chloride. Yeah. There's only one place on earth seraphinite comes from, and the deposit is depleted. Okay, so I put that there. And then what I do is I do this layout. I'm actually going to move it to there with these fine crystals. And what I'm doing is I am making a layout that will allow me to work in the synapses. So you get the nerve, and then you get a space, and that's the synapse where the nerves join in. And I just lay out a diagrammatic representation of the neurons and the synapses, like so. And the debate is which way should the crystals point, but this is which way to do it generally. And then I check after I've done it, when I've tuned into the person, should I change the direction of the terminations. And once I've had to turn them around. Otherwise, usually I'm doing it this way. And so that's why it's important to be able to feel yes and no with your body. Because you want to ask a yes or no question. Must I turn the terminations around? Yes or no? So right now I'm getting a no, this is correct. Or yes, this is correct, but I can feel both. Because I can feel yes and no in my body. So there's a blog about that on the website. I think I must redo it as well, make it even clearer for people. Right now we're just going to do this and lay these stones out. This is now the new thing that you have to do with your life, is lay stones out in patterns. And so I'm laying out like a map of the brain and the neurons. And that is a lot, but we'll just do symbols of the cranial nerves as well here. So now, usually with the nerves, I like to do afferent and efferent pathway. So those terminations, and I do like that. So I have one crystal pointing in that direction, another crystal pointing in this direction to denote the afferent and efferent pathways. And that's important. The thing is, it's like veins and arteries. You've got two directions of flow. With veins and arteries, it's to and from the heart. And with nerves, it's to and from the brain and spinal cord. So it's symbolic, and that's enough, is what I've discovered. And that also was by asking, is that enough, and getting the answer yes. And is this and then I tested it out. I worked on different people's brains and checked that this was going to work. And then what I do for the brain detox, and I'll show it when I'm working on you, is I'm literally going to go into these synapses to detox the brain. And I'm going to use the seraphinite and the blue uvite in mica. You can use any uvite together with the seraphinite. I like to use this. Look at that generous uvite crystal. It's like rather fabulous. Then I'm going to dig around with my shungite pyramid. I'm going to dig in those synapses. Then I'm going to stimulate the shungite to stimulate the brain function, so you'll feel nice and clear in your mind afterwards. It brings the blood and the oxygen to the brain, and that helps a lot. And then I soothe the nerves with morganite, and I have found this little stash of tumbled morganite stones that do the job as well as my fancy crystal.
Wow.
So I'm rather pleased about that. So there you can feel the one in the one hand and the other in the other hand. And then what we do is we coat the nerve endings with the tangerine quartz. And I use these in the micro session, and I literally coat the ends of the crystals like that, so that they're not oversensitive, because people's nerves are somewhat oversensitive. But when I do it in person, I'm going to use this one just because it's more visible. If I'm working with this, the camera's not going to see this little stone in my hand, so I'll use this wand. But that's all you need, the little tangerine quartz. So those are the instruments. So small crystals, seraphinite. It doesn't have to be botryoidal. I like this because it looks like a brain.
I was thinking that if that's why you selected it, it was 'cause
It
looked like
is.
the brain.
And seraphinite is for the nervous system. It's got an amazing affinity for the nervous system. And that was one of the first when our friend Jean, when he did this to me one day in Tucson, and I went with a seraphinite piece like this, and I went, oh my goodness. And that's how infusion got born, because he showed me this. We were in Tucson and he's doing this to me, and then we started doing this to people, and everyone was saying, what is that? What are you doing? What is that stone? So that's how it all got born, and there we are.
So soothing.
Shall we do it?
Yes.
Okay,
Yes.
let's do it.